So at this time, I'm going to introduce our final speaker. Dr. Maggie Stoeckel is a pediatric psychologist with expertise in cognitive behavioral therapy for youth with a variety of chronic medical conditions. Maggie completed her bachelor's degree in psychology at Harvard University and her PhD in clinical psychology at American University. She then pursued specialized training in pediatric psychology at Oregon Health and Science University for both her residency and fellowship. Dr. Stoeckel is a member of the Crohn's and Colitis Foundation Northwest Chapter Medical Advisory Committee. She has a passion for helping kids and their families with the ups and downs of chronic health problems. And she is truly a friend and someone whom I'm a huge fan of in terms of how she's supporting, especially our youth, but also all people with Crohn's and colitis area, particularly in Portland. So take it away, Maggie.
Thank you. What a nice introduction. Again, I'm Maggie Stoeckel. I'm a psychologist and I specialize in working with children, adolescents, and young adults with IBD and other GI issues. And one thing I so appreciate about today's webinar is that we are an interdisciplinary group, and I just think, as we all know, it's so important to address every facet of managing IBD. So for my portion of today, I'll be talking about the psychosocial aspects of IBD and focusing specifically on some tools for managing the uncertainty that can come with IBD. So just in terms of an outline, I'll start by addressing generally some of the psychosocial topics I talk with families about, and then hone in on specific ideas within cognitive behavioral therapy for managing uncertainty, and then conclude with discussion of some resources, both local and national, and then end by answering any questions that the group may have. So historically speaking, medical services were often quite siloed. So if you were to go to your gastroenterologist, they would do their work independently, and there would not be much discussion with the psychological team. And in this way, if you think about holistic care, that it was challenging to address gaps that may have come up in communication. And if you have siloed services, there's also an overemphasis potentially on the quote unquote organic causes for illness, and that lack of perspective of taking a look at what are the psychosocial factors here that could be contributing to pain or inflammation or other things that are going on with managing a chronic illness. Now, in cases where it's as obvious as taking a porcupine out of your belly, that's a different story. But as we all know, in IBD, it can be much more complicated than that. So again, historically, physical health was always separated from psychosocial health, but we now know that we can't do that. We have to marry the two, and what bring them together are what we call health behaviors. Health behaviors are the things that we do to put ourselves back in the driver's seat and take control of managing our IBD. Some examples of that are following the treatment regimen and communicating closely with our professional team, managing diet, managing exercise, having healthy sleep hygiene, which is healthy for all of us, following closely with the medical team and letting them know of any issues we're having, and then accessing social support, which can be so helpful for managing chronic illness. Another way of thinking about a chronic health condition holistically is looking at the biopsychosocial approach to health. So I won't go into all of the factors on this Venn diagram, but I do want to highlight that the idea behind this model is that we have to look at health thinking about the biological factors, the psychological factors, as well as the social context. And without all of these pieces, we're actually not addressing everything that goes into inflammatory bowel disease. So the bottom line is that there's many factors which contribute to health in IBD that go beyond the traditional quote-unquote doctor's visit. And by understanding the role of psychosocial health in IBD, we can lead to improved overall well-being. And that's why I love what I do. So just to start, I'm going to, again, highlight some psychosocial factors that I often talk about with families in my office. I don't know how many folks in the audience are just newly diagnosed with Crohn's and colitis. Some of you may have been managing your illness for quite some time, but wherever you are along your illness trajectory, there's always the impact of diagnosis, because with every iteration of your chronic illness, there is potentially an impasse where you're learning to navigate a new medicine or adjust to having surgery, or simply, not simply actually, navigating different impasses that may come up in your life, such as a transition to college or a new job. So one thing that I talk with kids, families, and young adults about is seeing the diagnosis period as lifelong, and not expecting ourselves to be able to do that all in one day. So we have to slow down that train. Oftentimes when we're newly diagnosed or we're facing a certain hurdle that we might have with IBD, it can feel like there's this giant storm cloud over our head, and it can feel like it's looming, and we're never going to reach a point where we're not constantly thinking about our IBD. But if we can take things one day at a time, that storm cloud will shrink down. It may come back periodically as we adjust to new iterations of our diagnosis. But overall, if we can just take things one day at a time and go easy on ourselves, our adjustment can be much more adaptive. And importantly, I feel like I mentioned this many times throughout my talk today, but it's so important to ask for help, whether it's your IBD medical team or if it's within your home team, your spouse, your friend, whoever it is that you feel close to. Don't be afraid to ask for help. And again, acknowledge that adjustment is a lifelong journey. Now, as a psychologist, of course, we think a lot about mood symptoms and anxiety symptoms. I'm going to focus a little bit on mood symptoms to start, because literature shows that those of us who are managing chronic health conditions are vulnerable to mood symptoms as we go through the ups and downs of IBD. And the Improved Care Now network, which is focused on peds, they suggest that because of the vulnerability to depression, that it's important that centers screen adolescents 12 and above for depression every year. I think this is just a great example of how we're increasingly recognizing the importance of psychosocial health in IBD. And I know in the adult world, it's becoming increasingly common for psychologists to be embedded in medical specialties and for there to be ongoing depression screening. A recent systematic review of adult IBD patients showed that depression rates were as high as 21.2% in IBD patients compared to 13.4% in healthy controls. And the depression rates rose to 34.7% when IBD was active. So this shows that depression is fairly common in IBD, but particularly when we're managing a flare or inflammation is particularly active at the moment. I want to highlight this study by Lori Kiefer. She's a psychologist at Mount Sinai, and she's been somewhat of a pioneer in the psychosocial health world in IBD. She comes out with a lot of really interesting research that I love to keep track of. But this study in particular, I think, is pretty relevant to what we're talking about. And she looks at the bidirectional relationship between depression and IBD. So I'm not going to go over all of the results, but I'm going to highlight something that I think is quite fascinating. So depression affects IBD, and IBD affects depression. I want to be clear upfront that I don't mean that depression causes IBD. There's not that causal link. However, difficulties coping with IBD can increase the risk for depression. Further, what Kiefer and Kane found was that when we're experiencing depressive symptoms, we may struggle with managing disease-related demands, which can then in turn lead to poor health outcomes in IBD, which might include higher levels of pain and stress, difficulties tolerating symptoms, and reduced quality of life. So these findings speak to the continued need to monitor patients for depression and to ask for help and seek treatment if needed, because it will help indirectly with our IBD health outcomes. I also want to talk a little bit about anxiety. And as you know, managing a chronic health condition can be anxiety provoking, particularly in IBD because of the unknown and the many ups and downs and uncertainty involved. In a study, clinically significant anxiety symptoms were experienced in up to 40% of the adult IBD patients studied. And further, anxiety symptoms were often related to flares, but it was shown that they could persist into remission. So this is a chronic challenge for lots of these patients. And once again, anxiety, just like depression, it does not cause IBD or cause flares, but it can make it much more difficult to manage and cope. And it speaks again to the need for early detection and treatment of anxiety symptoms. Now, I also want to mention that we've talked a little bit about depression symptoms, we've talked about anxiety symptoms, but there is potentially an overlap in terms of IBD symptoms and what we call illness-related distress. So I'm going to go into each of those. And first, what I'm going to show is that what can make the detection of mood symptoms and underlying anxiety symptoms challenging is that some of the traditional symptoms that we look for in depression and anxiety do overlap with some symptoms of being in an IBD flare. So just take a look at these symptoms of depression. As you scroll through, you might see that some of these things sound like how you might feel when you're in a flare. So decreased energy or fatigue, potentially loss of interest related to not feeling well, difficulties concentrating, changes in your sleep, potentially due to urgency or other challenges that can come up with IBD, appetite changes, and so forth. So you can see there are some diagnostic challenges in assessing for mood issues if we're also having IBD-related issues at the same time. And here are some symptoms of generalized anxiety. You can see that many of the physical symptoms here, muscle tension, headaches, sweating, those kinds of things may also come up when we're in an IBD-related flare. So again, there's that overlap. So we have to be particularly careful when evaluating kids and adults for depression and anxiety, and just considering what is the big picture here, what is potentially IBD related and what it speaks to an underlying mood or anxiety problem. The other facet of this is what, just to go back to that previous Venn diagram, is illness-related distress. And so those are things that are unique to the distress factors that can come up while managing IBD. So just to scroll back. Aspects of illness-related distress in IBD may include fears or questions about living with a chronic health condition, the impact of symptoms on social functioning, which can differ depending on how old you are. But for young kids, it typically has to do with the impact on the day-to-day. Are you able to go to soccer practice? For adults, it might be, am I able to be there for my spouse, my partner? Am I able to go to work regularly? Things of that nature. Body image concerns. This can come up a lot for the patients I work with who may have an ileostomy or are managing some other kind of physical change in the setting of their IBD. Illness-related distress may also include feeling overwhelmed by the treatment regimen, having trouble with adherence, burnout, and I'll go more specifically in a few slides to burnout. And then also difficulties with medical team interactions can come up. So as a psychologist, everything on this slide is kind of the bread and butter of what I do in working with patients and their families and managing IBD-related distress. So if you notice that you're experiencing any of these issues, I just encourage you to talk to your gastroenterologist and to see if it would be worth speaking with a health psychologist like myself to get some support in that area. I have to say also that it's really important, again, to differentiate mood and anxiety symptoms from illness-related distress, because treatment will differ significantly depending on the primary mechanism. If something is IBD-related, it will really benefit you from working with a psychologist who has expertise in IBD, because there may be kind of misunderstandings about what the contributing factors are if there's not that baseline level of knowledge. So that's where you can ask your gastroenterologist if they know of health psychologists who specialize in that area, and look to your insurance company for support in finding folks that are covered. And towards the end of the talk, we'll talk more about ways to go about finding a psychologist if that is of interest. Now, burnout. These are the many faces that we might see related to IBD-related burnout. It can look really different depending on how old you are. In young kids, chronic illness management burnout may look a lot like disruptive behavior, tantrums, kind of emotionality that's it seems to be sort of coming out of nowhere. As you get into the teenage years, it may look like withdrawal from your medical care. It may look a lot like depression. And then into adulthood, it can be a combination of what looks like depression or feelings of being overwhelmed. Now, I took this definition off the internet. When I was looking into burnout, there is a lot of literature on workplace burnout. This is kind of where that term originated. And one of the definitions that I found most compelling was actually meant to refer to workplace burnout, but I think it relates quite well to what we talk about in managing IBD. So burnout is a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. It occurs when you feel overwhelmed, emotionally drained, and unable to meet constant demands. So that might ring true to a lot of us in managing IBD and making it fit within our lives. And burnout is something that I really enjoy working with patients on because it doesn't just go away overnight, right? It's something that requires a nuanced approach. Some common signs of burnout in IBD may include feeling overwhelmed and defeated by IBD, feeling angry about IBD, feeling that IBD is controlling your life, worrying about managing IBD, but also not feeling motivated to engage in self-care. I think that's an interesting kind of conundrum that I work a lot with adolescents and young adults on. So we might feel so overwhelmed by our IBD that we either procrastinate the things we know we need to do to take care of ourselves, or we just try to go into denial mode or quit our IBD altogether. We might also feel so alone with our IBD and go to the extreme of hiding it from others because this is a way of kind of making it less real, keeping it separate from us. So in order to address burnout, we first and foremost have to notice these signs and access social support. Just ask for help, whether it's from your medical team or from someone in your life to get on the road to managing these feelings of burnout and feeling withdrawn from your life. We might also need to look at our big picture priorities. So what is important to us in this life, and how might we need to make some adjustments in order to be able to manage our IBD, but also be the kind of partner, friend, brother, sister, whatever it is that we want to be. So we have to practice being mentally flexible at times to be able to meet all of these competing demands. And once again, I'm a broken record here, but connect with your medical team and look into working with a health psychologist if that feels like it would be helpful for you. Okay, so I'm going to spend the majority of my talk looking at managing uncertainty, because the only thing that's predictable about IBD is that it is unpredictable, which can be such a daunting feeling at times. But there's many helpful tools that we can draw on to manage these times of uncertainty and worry. I'm just going to talk a little bit about cognitive behavioral therapy, which is the type of therapy that I specialize in, and it can be particularly helpful for managing uncertainty using specific tools. So in CBT, we focus on identifying unhelpful ways of thinking, identifying learned patterns of behavior, and then adjusting those thoughts and behaviors in order to affect feelings. We look at what's called the CBT triangle, which is at the bottom of this slide, and it shows the bidirectional relationship between thoughts and feelings and behavior. So it's a cyclical cycle. Unfortunately, if we're feeling depressed or we're feeling anxious or we're experiencing illness-related distress, we can't just turn that off like that. I wish it was that simple. But we can look to what is within our control related to our thoughts and our behavior and change those things to in turn reduce our psychosocial distress. So now I'm just going to go through a few CBT techniques that may be helpful in managing IBD, particularly around uncertainty. Some common maladaptive strategies for managing anxiety and uncertainty include information gathering and planning. When we're anxious, we convince ourselves that gathering more and more and more and more and more information can be really helpful. But the reality is that that actually only goes so far, and that excessive information gathering can actually increase our anxiety. Some of us may be experiencing that right now if you have the news on all day related to the health issues going on around our world right now. We may feel like we need that flood of information, but it actually just puts our anxiety through the roof if it's not well controlled. We may, when we're anxious, do excessive checking or clarification of information. This may be kind of in the health world. This may be what we do when we have questions about our IBD, kind of checking in with our doctor frequently. And in the short term, this may provide some relief, but in the long term, it can make our anxiety and our difficulties in managing uncertainty worse. Another maladaptive strategy may be avoidance or procrastination, and then again, that reassurance seeking, which kind of relates to the excessive checking. We may constantly reach out to our loved ones or to our doctors for reassurance around how things are going with IBD. And unfortunately, there aren't always clear answers for, what is the next year going to bring with our IBD. We just don't know, and that's a really hard pill to swallow when we're trying to plan for our life. But there are things that we can do about it from a cognitive behavioral perspective. One thing I talk with patients about is defining the controllable versus the incontrollable variables in IBD. So things that are out of our control are disease activity, our level of inflammation, the impact of our medications. We can't necessarily control, are we going to respond to Remicade? Are we going to respond to Humira? What is our body going to do in response to that? We also can't control the unpredictable course of IBD. However, if we take a look at what we can control, we can make sure that we're practicing good sleep hygiene and getting the amount of sleep that's healthy for us. Food choices. So to get back to Tina's talk, we can look to the literature and look to our doctors for, are there dietary strategies we can use to manage our symptoms? We certainly can control that. We can control our efforts to engage in self-care, so the things that we do to just take better care of ourselves. It might be as simple as making sure that we take a bubble bath every night, or make time to go out with friends, even when we feel like we have lots of competing demands in our life. But if we neglect the self-care, the uncertainty can become even more overwhelming. We can access social support, and we can be engaged in doctor's visits as well. So we can go to our visits with potentially questions we know we want to ask, and topics that we want to get answered, and take in that information and then put it into action when we get out of that appointment. Another thing I talk with patients a lot about are what are called cognitive distortions, which are ways that our mind convince us that something isn't real. Our mind convinces us of something that isn't really true, and this can come so automatically with managing the uncertainty that comes up with IBD. Cognitive distortions, they can contribute to difficulties with uncertainty in many ways. So some examples of cognitive distortions that you may or may not have experienced include uncertainty is unacceptable, or I can't handle uncertainty, I can't handle the unknown, or IBD is completely ruining my life. Those may be things that could pop into your head related to IBD. Now, in cognitive behavioral therapy, what we try to do is reframe those cognitive distortions. So flip those negative thoughts into something more positive and more adaptive that will help us move forward. And this might start with a paper pencil exercise in a psychologist's office or at home, but the idea would be that the more that you engage in those types of exercises, it becomes more automatic and you're able to do it in your everyday life. So as an example, you might reframe uncertainty as unacceptable into uncertainty is not ideal, but is acceptable and tolerable. You might flip I can't handle uncertainty into I don't care for uncertainty, but I can handle it. And finally, you might flip IBD is completely ruining my life into IBD is hard right now, but I will get through this blip. And once again, you might not believe these reframes right away, but with greater repetition, they will eventually override those cognitive distortions, the statements in red on the screen that are making the uncertainty feel more overwhelming. Now, for the next few slides, I'm going to talk about a specific flavor, if you will, of cognitive behavioral therapy that's called acceptance commitment therapy, or ACT. And I bring this up because ACT-based strategies can be particularly helpful in managing uncertainty. The goals of ACT are to aim for acceptance of unwanted private experiences which are out of our personal control. And that sounds similar to what we've been talking about related to managing uncertainty in IBD. ACT therapists also focus on committed action towards living a valued life, and at their core, they look to increase psychological flexibility. Now, ACT-based therapists look at what's called the ACT hexaflex, which is at the bottom of this slide. I'm not going to go through each of the components, but I will give a few kind of bread and butter strategies that address the domains of acceptance, values, and contact with the present moment. So I'm going to do a brief exercise. This works better when we're in person. I'm going to do my best with a webinar format, and hopefully you guys can see me on the camera. So an acceptance exercise that I often do with patients and their families is practicing acceptance of the uncontrollable. And one way of doing this is what I call the post-it exercise, which is something that's really common with ACT therapists. So if you take a post-it note, try to hold it out as far away from you as possible. And imagine that that post-it note is your IBD, or is something that's incontrollable about your IBD. So let's say it's your level of disease activity, or it's the amount of follow-up that you have to have with your doctor, whatever it is that's really getting you down that day related to your IBD. And so in my office with patients, I'll have them hold that post-it out as far away as possible. And you can imagine if you sit like that for quite some time, your arm gets really tired. This is sort of an experiential way of noticing what it's like to try to hold something as far away from us as possible. It's exhausting. It spends a lot of emotional energy and physical energy. It's really draining. And so I sit there with patients and I have them notice what their arm feels like. And I particularly like doing this with teenagers because they usually make kind of a smart aleck comment in response to it. They talk about how sore their bicep is, or we kind of have a laugh about it. But I think it's a really great way of noticing what it's like to really try to push something away. So that might be our IBD, it might be simply the uncertainty. But if we react to that uncertainty instead by taking our arm closer to us and actually just putting the post-it note on our chest, we can rest our arm, we can rest our emotions, we can rest our body. And while the post-it note is still ours, it's with us, it's on us, but we're not expending as much energy. So it's a way of thinking about how can we accept the things that are out of our control? How can we accept that we live with IBD and move on with what's important to us? So it's an exercise that whether you just did it now or you want to do it later on your own time, I think it's something that it's a kind of a good gut check for all of us. It's a way to really recognize what are we putting our energy into, what are we pushing away, and how could we actually channel that in different ways to better manage our IBD and accept the reality of things. Now, another important aspect of ACT, again, is increasing contact with the present moment. These are some exercises that, again, do best with kind of in-person contact, but I'm going to describe a few of them briefly. So mindfulness exercises are one great way of increasing contact with the present moment. So some of those things might include noticing your breath, noticing sounds in the environment, noticing your chewing or steps. So it's a way of focusing on a specific auditory sound as a way to keep your mind engaged in that, rather than the flood of uncertainty that might be on your brain at a given moment. Progressive muscle relaxation is a nice mindfulness exercise that kind of, it combines muscle relaxation with sort of meditation scripts. And at the bottom of the slide, I put some apps that have some great scripts for that. Breathe to Relax, Headspace, and then Relax and Rest guided meditation. So I suggest if you're interested in trying these exercises that you start with an app on your phone or with a YouTube video, having someone really walking you through it, because I think it's hard to learn the tools without having someone walk you through it first. So those are just some ways that we can get at the mindfulness aspect of ACT therapy. And finally, one other area that I want to address that I think is particularly applicable to managing the uncertainty in IBD is the values component of ACT therapy. So this is where we push ourselves to look at our values before taking action. ACT therapists believe we're most fulfilled and psychologically sound when we're living in line with our values. It's when we are doing things that aren't consistent with what we believe that we experience greater depression, anxiety, or illness-related distress. So some questions I might ask of the patients and families I work with to kind of get at this are, what do you really want in life? What sort of person do you want to be? And what do you want your relationships to look like? These are some of the things that might start honing in on what our values are. And to take a deeper look at our values, we might do an exercise like this, where we look at what do we value in the domain of work and education? What do we value in leisure, relationships, and personal growth and health? And on a given day or a given week, we start to rate ourselves as to where we're at. The goal, of course, is to get a bullseye here, to feel that we're living consistently with our values at all times. I think it's a pretty tall order. I don't know if any of us are, hitting the bullseye every single day. But we can at least try to move these X's, they're in the red and yellow, closer and closer to the middle. And on a given month, our health may take priority related to our IBD, but on others, we may be prioritizing these other aspects of our values. So once again, this is it's just one way of taking a big picture look at ourselves, and by looking at our values, we can help live a life more consistent with what we believe in, and this in turn can help us manage the uncertainty that comes up with IBD. So that's where I'm going to end in terms of the specific strategies, and that was just to give you kind of a little bit of a picture of what you might learn from working with a psychologist. But I'd encourage any of you to reach out to your medical team if you're interested in doing some work with the health psychologist, because I think it can be incredibly useful. Ideally, you can meet with a psychologist right when you're diagnosed with Crohn's or colitis, because I think that can kind of normalize us as part of your treatment team and help you move forward in managing the ups and downs of your chronic illness. Psychologists are becoming increasingly embedded in medical specialties, but if you don't have one in your GI clinic, you can work with your insurance company or ask your GI doc if they know of folks in the community that's special in what's called health psychology. I know I keep using that term, but what that means is a provider who specializes in helping patients who have chronic medical conditions. So it's a particular niche within the psychological field. The American Psychological Association has a provider list on their website, so I put that on the slide here. You can also look to the Crohn's and Colitis Foundation for the local support groups, and you can also consider starting one of your own. I found that grassroots support groups can be incredibly powerful for patients. So that's all that I have for you guys today. I put my contact information here if anyone wants to reach out to me directly, but I'm happy to answer any questions that folks might have. Thank you.
Wonderful. Thank you so much, Dr. Stoeckel. Really appreciate that. Thank you, Tina, as well, and all of our presenters, both David and Anthony. Really exceptional job. So appreciate the practical application that you all shared with us in terms of how we can take care of ourselves and live more fulfilled and joyful lives. These presentations will be available later. As soon as we get the translation and the download, I'll be able to share them all with you. I will also be sharing an evaluation. We'd really appreciate it if you would take a few minutes and fill out that evaluation so that we can get kind of an understanding, how did this webinar format work, etc. Mostly, we appreciate your taking your time this afternoon, appreciate your patience as we worked through trying to switch formats, given the current situation about COVID-19. And we thank you for supporting the Crohn's and Colitis Foundation. I would like to encourage any of you that are interested to check into the Take Steps Portland Walk that will be coming up on May 17th. There's still time to get a team, bring your family down, and even if you don't have a team, if you come and visit, you'll at least get to see the community, the more broad community at hand. And I'm just looking for the location of that, sorry. It's at the World Trade Center, 121 Southwest Salmon Street in Portland. And we would love to see as many of you there as possible. So in closing, I want to thank Takeda, Janssen, and AbbVie. These were our sponsors today. I want to thank Peggy Merchant, our local community manager there in Portland, and Mark McNamara, our support group facilitator who helped us out today and has helped for years in the area. I want to thank all of our support group facilitators